In this presentation, I'll be sharing with you guys the application we developed, Ortho on FHIR, that enables post-surgical outcomes tracking and reporting that includes both surgeon and patient's inputted data via interactive mobile applications. So before we start, I'd like to introduce myself first. My name is Sistania. I am a software engineer and lead of integration in Rimidi. I also lead the Ortho project specifically as well. My background is in biomedical engineering. I completed my undergrad from Georgia Tech. I then did a few years of research in neuroengineering slash computational field. Unfortunately, research is not my forte. So then I joined Rimidi 2 years ago. A bit of a background about Rimidi. Our goal is to design a solution that aims to support quality improvement, workflow optimizations, clinical workflow optimizations, and patient engagement objectives across a variety of different disease states and use cases. Obviously, this is all within the existing clinical workflow of the hospital themselves. So before we get started into the solutions or the project itself, I guess I want to touch into what are the actual existing challenges in the surgical field, especially in orthopedic surgery. So surgery can be a prolonged and frustrating process for both the surgeons and the patients due to a few reasons that we can name for this specific project. So first, orthopedic surgery involves multi-step processes pre and post-surgically. Pre-surgery and post-surgery documentations for the surgeons are crucial steps, but these are unfortunately still often done manually. Second, patients' post-surgical outcome measures reportings are also still delivered manually to the patients. Therefore, these are sometimes missed and incomplete. And obviously, this is an efficient way for the clinical staff to follow the patient's post-surgical performance. Last but not least, there has been an increase in effort to track clinical outcomes post-surgically and research effectiveness of medical devices that are used during the surgery. So given all of these industry challenges, Emory came to us and they were looking for a more efficient way to collect, track, and report surgical procedure data and post-surgical patient-reported outcome measures for their orthopedic surgeries. We have then been working closely with both their clinical and IT teams to develop a seamless and interactive mobile apps for both the patients and surgeons that leverage FHIR API to integrate with the EHR and their existing patient-reported outcome system that they have been managing for the past few years. We were then able to securely collect and synchronize data from these multiple data resources to ensure continuous, efficient, and engaging user experience for both the patients and surgeons. As you can see here on the left are the examples of some of the screens that the surgeons can interface with. And on the right are examples of some of the screens that the patient's user can interface with. Both of these apps leverage EHR credentials with OAuth 2 framework, so they can sign in using the same credentials they use to access their EMR or their health portal from the patient and from the patient standpoint. Some of the highlighted features from these from the provider app is that it enables the surgeon to document the surgical detail of the procedure they have just done for the patient very conveniently. It also allows them to track the patient-reported outcomes in a graphical way or in a aggregated way to better capture the patient's improvements post-surgically. From the patient standpoint, the main features of the app are: one, patient can be reminded to report their post-surgical outcomes daily and can submit their score straight to their surgeon. So in this case, like the surgeon can then see the improvement of their pain score for this patient's post-surgically. It also allows them to keep track of their medication intake and their physical therapy assessment post-surgically. All in all, the interaction between the patients and the surgeon-facing apps is aimed to create a more cohesive and efficient post-surgical processes for both the patients and the clinical staff. If you guys have any questions, feel free to drop in the questions or chat in the chat box as well. A few of the FHIR resources we use for these projects are the patient endpoint. So we use the patient endpoint to collect the demographic information of the patient, use the practitioner endpoint as well to collect the demographic information of the surgeons, and appointment endpoint to get the surgeon surgical appointments. Lastly, we also use medication statements to get the patient's medications. The data that would obtain from FHIR, we also are able to relate and synchronize with the data that we get from their existing patient-reported outcome systems. So to ensure this continuous integrations between these two data sources. Obviously, with any projects, there are always new things that we learn along the way. First, before we even get to any technical aspects of the project, understanding the clinical workflow, discrete steps, key dependencies and requirement, and any existing clinical content that exists on like paper or in any manual way. Well, we really need to understand these aspects of clinical workflow care pathway aspects of these before we even get to the logical coding or what we need from the FHIR resources or whatnot. So just wanted to highlight this part before we get to the technical key learning. So, but from a technical standpoint, we have to design and organize and logical data models to enable that the server can do the heavy lifting on the back end when it comes to the data filtering, so that we can ensure an efficient and fast data filtering process on the client side, because that's also one of the main features from the surgeon-facing app. Another technical key learning here is to make sure that we have a secure data synchronizations with the client's existing database, and how to relate this data that comes from them with the data that comes from FHIR. This aspect is pretty crucial to ensure we have a seamless and continuous integration. And lastly, but not least, every EHR has their own security requirement, and on this specific project, they require us to have a multi-factor authentications within the app, especially from the provider standpoint or the surgeon-facing app. And so we learn how to implement the multi-factor authentications with DOAuth 2 that we leverage with the EHR credential as well. So yeah, these are all the things that we learned from this project. We're pretty sure that we're probably going to learn more things as we go into the app maintenance state. But yeah, I'm happy to share this this project with you guys. And if you have any questions, you can feel free to shoot me an email in the chat box or anything that we use here in Wova app. But I think that is all I have for the day. And I'm going to open the floor for Q&A. Thank you.
Hi, Sistania. We do have a couple of questions in the Wova chat. Would you like me to read them to you, or do you have it open?
I have it open here on my Wova app. Let's see. So I can go ahead and read the questions and answer it as well. Okay, so the first question here is the provider-facing app also available in the EHR as Smart on FHIR? So for this specific project, no. This is purely on the mobile app. So we actually take the FHIR-based URL and put the ISS code into our login button on the mobile app, which directs them to, in this case, Cerner authentication page. However, on a different mobile app that we work with them with, we have a Smart on FHIR launch to the provider app within their power chart, in this case, Cerner. And the provider should be able to launch into the app. But for the specific ortho apps, the client specifically asks for mobile apps that does not require them to go into their power chart. Second questions I have here is, how is the FHIR data visualized in app? So the FHIR data that we use predominantly for this app, especially for, let's just say, for the provider app, we have the provider practitioner endpoint, the patient endpoint, and as well as the appointment endpoint. So a lot of these data are actually visualized in the client side in a very kind of like modern user experience way. So they don't know that these are like actually from FHIR. So we actually display them as if you would see your profile informations on your Facebook app, for example. So they're visualized in a pretty user-friendly way, I would say. And for the appointment one, this is a pretty cool one because one of the main feature of the provider or the surgeon's facing app is for them to be able to see the clinic, their clinic and their surgical appointment. So we are actually able to display for them their appointments, surgical appointments for 7 days ahead from today or 7 days in the past. And we're also using the appointment endpoint and also from their database, their patient-reported outcome database to display the patient post-surgical outcomes on the provider standpoint. From the patient standpoint, we really use the patient app to be able to send this reminder via text daily as part of their post-surgical outcomes. So not only we display this app, but we use some of the data for, in this case, the phone number and the email to be able to make communications with the patients for this reminder. We also use the schedule, the appointment schedule for these patients to know what surgery that they just had, so that we can sort of on the back end know what to display for them, like what kind of pain, what kind of body part of the pain score that they need to submit, for example, and what kind of physical therapy assessment that that surgical procedure that they just did require them to fill in. I hope that answered the questions. So the third question here, oops, sorry, there's like, they keep moving. How do we store the FHIR data? So we actually do a batch job, for a batch job every night, so about like 12 like midnight, and we then store the data in our database. So we use a PostgreSQL, and they're obviously encrypted, and we also integrate with their patient-reported outcome system database via SFTP shares, and then we can use their NPI number, for example, for the provider to sync the data from the FHIR and the client's database. But all in all, they are stored encrypted in an encrypted way in database in PostgreSQL. Let's see. Are the PROs stored as FHIR questionnaire resources? This is a really good question. When we first started this, project, we thought that maybe we should store the pain score in as a FHIR questionnaire resource, because we think that maybe that could be, we can then post the data that, I guess, like the pain score that they submitted into a notes via a document reference endpoint. However, that doesn't seem to fit the client objective, because they want the data to be available for them for research purposes in this case. So therefore, we do not store the data as a FHIR questionnaire resource. We actually store them as part of the app server database. But they would be cool though to have a more kind of like more complex questions that we can actually leverage the FHIR questionnaire resource. We did have on a different project, separate project with different client, that we ask questions in the survey via FHIR questionnaire resource and be able to push that via document reference post. Let's see. More questions. I got 5 minutes. Okay, answer more. Could you provide an example for client application you have connected with this app? Let's see if I understand these questions. So when you say client application, you mean, I guess like this refers to the hospital system that we have connected with this app, or the EMR? Okay, so from hospital, I hope I get that right. From a hospital system standpoint, we have connected this app.
Hi, I was looking at more on the client side. Is this app connects to an EHR or an EMR, or what kind of application? Yeah.
Gotcha. So this specific project, these specific apps are actually connected to Cerner as the EMR, because Emory is based in Cerner for their EMR. So yeah, they're fully connected both in productions and non-productions with Cerner in the client's hospital system. Okay, thank you. You're welcome. I think the last questions I have here is, do you use an open source FHIR store backed by database at your choice? How about managed cloud service like Google Healthcare API? What do you think? So yeah, I think after attending some of these talks here, it has kind of largened my my knowledge about all the other ones. But for this specific one, we actually use use the FHIR DSTU2 and R4 from the EMR specifications, not so much from the managed cloud service like Google Healthcare API. But it would be cool to kind of go to that directions as well. But for this specific purposes, the clients, obviously, because the client has a EMR already connected with them, and the EMR already apply the FHIR specs in their server, in their FHIR server, we're able to do that directly to against their EMR.
Okay, we are actually out of time.
Okay, I think I answered all the questions.
All right. Well, I want to thank everybody for coming, and thank you, Sistania, for your great presentation and Q&A session. And I just wanted to remind everybody to rate the session in Whova. Thank you very much.
Thank you, guys.